I'm Shane Chapman, Associate Professor of Dermatology at Dartmouth-Hitchcock Medical Center in Lebanon, New Hampshire. So I think the main appeal and success of the book has a lot to do with the photography and the photographs. They're large, they're clear, very easy to see, and it helps in the clinic in real time with diagnosis, both for dermatologists and non-dermatologists. So the photography in the book, the actual clinical cases, I think is a huge benefit for the reader. So the other publication that we have with Elsevier is the Dermatology Derm Deck, which is a new type of product, a new type of media for education. It's a laminated cards that are bound that you can easily put in your pocket. So for residents, medical students, other learners, it's very easy to carry and transport. Also has great photographs, but it has a very brief blurb, if you will, of the diagnosis and treatment of the diseases on the backside of the card. And this contains easily the most common 200 or so dermatologic diseases. So the appeal is that it's easy to transport, and very readily available for people on the go who just need a very brief update on what they're seeing in the clinic in real time, which is different than any other media that's out there today. The other interesting thing about both the skin disease textbook and the dermatology deck is that it is in multiple languages, including Mandarin Chinese, which I don't think at this point has been produced by any other textbook. The dermatology deck is an easily transportable diagnostic tool that both residents, medical student, and any physician, anybody seeing patients, quite frankly, can have in their pocket, readily available for diagnosis and treatment options on the go. So some of the new exciting sort of cutting edge things that are happening in our dermatology specialty is clearly the laser availability and improved technology in laser and phototherapy. Monoclonal antibodies are now a mainstay in dermatologic treatment for inflammatory diseases and cancers, skin cancers in particular. And a lot of dermatologists these days are traveling more to underdeveloped countries, helping out, volunteering, doing work in dermatologic work overseas and out of the country. So in the book and the dermatology deck, we've tried to incorporate both laser, cosmetic procedures, complications of those procedures, which may be more helpful to the doctors who are reading this, as well as incorporating the newer therapies that are out there, including the monoclonal antibody therapies, the injectable therapies, things like Humira, Enbrel, and Remicade for psoriasis and other diseases. And then also we've put a section in the book for really travel medicine and travel dermatology with diseases that we don't see very often in the United States. But if you do any traveling to Central America, Africa, the Middle East, Asia, you'll see some very different diseases, mostly infectious in nature, but you'll also have a summary of those particular diseases with excellent photographs as well. One of the huge reasons for our success with the book, I think, is working with a company like Elsevier, who incorporates the physician in the entire process, not just the intellectual process, but the editing of the book and going back and forth and making sure everything is as we want it and you guys want it. And then I think the marketing piece of this, I think, is really unusual. Most physicians don't know anything about business or marketing, and we would be lost. We could write a really great book, but without a company like Elsevier to market it and get it out there on the bookshelves to our colleagues, it wouldn't be distributed well. And I think that the big part, or the big role that Elsevier has played, is incorporating our creative ideas into the book and not excluding us, and also doing a tremendous job of marketing it to our physician colleagues.